everyone, Amanda here, CEO and co-founder bariatric coach from Bari Better Inc., where we provide online bariatric weight loss coaching to clients in 3 different languages, in Spanish, English, and Portuguese. And today I have the pleasure of interviewing Dr. Ricardo Lopez, a bariatric surgeon from Guatemala. We actually met in Dubai in one of the international conferences of obesity and bariatric metabolic. So it's been a great pleasure to be in touch with Dr. Ricardo. We've been talking on a weekly basis and exchanging information and knowledge. So it's been a wonderful experience. And today we'll be talking about bariatric coaching. And it's my pleasure to have you present here with us. I met you with my husband in the conference, who is the co-founder of my company. And thank you so much for being here with us today. Our interview would be divided in 4 different segments. And I greatly appreciate your time. Thank you so much for joining us. And we are here to help clients who are thinking of having the weight loss bariatric surgery, or perhaps already had the surgery. So we'll be talking about coaching, and we have been in touch, and he is one of our board advisors. So it's my pleasure to introduce you all to Dr. Ricardo Lopez. Thank you so much for being here with us today. I appreciate your time.
Thank you for the invitation. It's always a pleasure for me to share information. And definitely was an exciting time when we met during the International Federation of Surgery of Obesity World Congress in Emirates. So it was a wonderful time, wonderful knowledge sharing, and we got the chance to meet each other in order to share this small alliance with knowledge about bariatric and bariatric caring. That's the most important thing, how to care about bariatric patients. And that's why we are here. I am a bariatric surgeon. I was trained in India, in New Delhi. So it's a country that has a lot of influence in metabolic surgery, and one of the main countries that has leading research in bariatric topics. So it was so glad to meet bariatric coach, and that's why we're going to talk about right now. I know that what is coaching and what is the purpose of Bari Better Inc. So thank you for invitation.
Of course. Thanks so much for being with us. And as you know, when we met, you met my husband and I in Dubai, and we share with you what we do and how we provide online bariatric coaching to clients. A little bit about me too, as you know, and I shared, I had the weight loss bariatric surgery, the gastric bypass. So I'm a surgeon myself, so I am a patient, and it's been a pleasure to be able to help people through their bariatric journey. And that's what we're here today to talk about, bariatric coaching, and what we really are going to talk about today. That's our topic. So let's start with that. As a bariatric surgeon, how could you say, and what could you say to our audience, people who are listening and viewing us today? As a surgeon, what would you say, what is coaching, if someone comes and asks you?
Well, yeah, about coaching, we have to know the meaning of the word. So coaching comes easily from something that's sports related, because coach comes from somebody that teaches, somebody that guides, and somebody that already has the knowledge in order to take a team or an athlete in order to make the good things, the good steps, in order to have a better result. So coaching is a term that's all the time it's being used in order for somebody to help and guide a team or a person in order to succeed. So if we want to do coaching, and if we want to, in our life, not only in medicine, in bariatric, there's a lot of aspects and a lot of topics when we have needed somebody to teach us what is the way, what is the best way to do it, and what we do if we fail, or what we do if we need some advice. So in our lives, in all aspects of our lives, we have needed coaching all the time. in order to get to this point of our lives. So I believe that that is the most important thing about coaching, that it's a process that somebody will help us to get to succeed something in life that we need.
That's great. And for your own experience, right, how do you feel that bariatric, that coaching itself applies to bariatric life? You know, as a bariatric surgeon, how do you see the importance of the online coaching too? Because we talk about, you know, at Bari Better Inc., we do not provide any medical advice. We do our services online. So it's about, you know, the client's goals and help them achieve from point A to point B, and things that we'll talk more in details in a little bit. But how do you see, as a bariatric surgeon, what is the importance of online bariatric coaching in your opinion?
Well, if we talk specific about bariatric coaching, we have to talk also what's the meaning of bariatric process. And bariatric process means weight loss. And for a weight loss surgery or a non-weight loss surgery, bariatrics means weight loss. So if it's for surgery or non-surgery, it's a process. And it's a process that it's not only a 1 step or 2 steps or 1 day, 2 day process. This is this is a life-lasting journey. It's a life-lasting road that you need to take in order to have good results, better results. And talking about patients with surgery, all the patients need to be prepared. All the patients have a pre, a trans, and a post-op follow-up, or they need to do checkups before surgery. And there are going to be a lot of questions that your doctor or your surgeon itself is not going to be in the possibility to answer the best way. So bariatric journey, it's a process that definitely during the entire life or the entire process that can take up to a lot of years, 10 years, 5 years. That process I could say it's endless. During all that process, we need somebody that can help us to guide us through every step before surgery, during recovery, and after surgery, all the years that it will take in order not to fail. A bariatric surgery can fail 5 years or 10 years after the surgery. So if we have a good coach, we have somebody that can bring me through that process. And it's better that somebody that have already passed through the process or is passing through the process. What a better way to give me that coaching and guide me through.
That's wonderful. Now let's talk about the online service itself, right? Through our conversations that we talk about bariatric in general weekly when we have our meetings, how do you see the online itself? Like, you even tell me stories about your own patients, like you are in Guatemala, and within your country, sometimes you have to go to a different hospital, something that is far away from you, and you're not able to see all your patients all the time in person either, right? So with the use of technology, how do you see the advantage of providing online coaching? Just like now, I wouldn't be able to be in Guatemala at this moment and interviewing you. You cannot be in the United States right now interviewing, right? So how do you see the online itself for all our clients and you know, for your own patients, like with telehealth medicine right now and things like that? What is your thought on that?
Well, to answer that question, I believe that bariatric surgery is one of the most surgeries performed as medical tourism. So most of the patients will search better outcome with less costs, obviously cost-effective surgery, with very good surgeons in very good bariatric centers that are not nearby. So my immediate recovery and my post-op recovery that can take several years, as we have said, it needs guidance, it needs coaching. And definitely, most of those patients that search far away places to do the surgery, the tool is going to be online. Online, it's immediate, fast, anywhere, anytime, resolution of my most frequent asked questions of my surgery or my process of getting better. So online, definitely it's going to be a tool that any surgeon, any physician, any group will try to provide the patient in order to have a better outcome. And what can we say? No, everything right now, telemedicine, not only in this time, in this era. Before any of the social restrictions, we needed online services because it's, as we said, immediate, anywhere, anytime, help of my questions. And you're gonna have questions anywhere, anytime, any place. So definitely online it's what we need right now in order to give results to our patients. And as any company like Bari Better Inc. that can guide a patient anywhere, anytime, any place, to give you answers of your questions when you have doubts. If you are bariatric patients, definitely online is the way to respond right now.
Wonderful. And that's one of the things that we talk to in conferences with other doctors and people in the bariatric field when we meet, right? Like the surgeons are so busy with the surgery itself and with clinics and with other days. And then we have the nutritionists who are, busy with the other side of the story, and then the psychologists. And so it's a multidisciplinary team. And how can we, as, also bariatric coaching, give that extra help and assistance to them? And online is a great way to go. So I greatly appreciated your thinking, your thought on the online bariatric coaching and how you see that and how you view it. So just so our viewers and our listeners know, our interview today will be divided in different segments. So this was part of the first segment, and now we started the other segment. And here's another question for you.